This
for every
conference will now be recorded.
Use heart means to think differently, make the right decisions, and act with courage and help others. So this is what the theme of the World Heart Day. That is, use heart for every heart. So in this occasion, we are blessed with the presence of our esteemed speaker, Dr. Rajashekhar. So I welcome you on the behalf of management and our principal, sir. Welcome you, sir, for the guest lecture, sir. So let me
Thank you.
introduce our guest speaker, Dr. Rajashekhar Sanpeti, sir. So sir has completed his BMS degree from SVM Ayurvedic Medical College in the year of 2000, and sir has completed his MD in Panchakarma from the SDM College. So sir has a total of 15 years of teaching experience, and sir has attended more than 32 seminars, conferences, CMEs and workshops, and sir has presented more than 4 scientific papers in the national and international level, and sir has delivered more than 18 guest lectures in the various places, and sir has organized many of the seminars in the state level and also in the national level on the topic of Hridya and the management of coronary artery diseases through the Ayurveda, and one more workshop symposium on interpretation on ECG at the KLA Ayurveda Mahavidyalaya and Hospital Belagavi. And also sir has many of research projects under him, and sir has published more than 5 scientific publications, and also sir has guided more than 10 PG scholars, and sir has conducted more than 29 free cardiac camps, and in that the more than 800 patients were benefited in that camp. Sir has also had had many of radio talks and also the TV programs given by the sir. So on the topic of Hridroga, that is Panchakarma Chikitsa in the Hridroga, Panchakarma Chikitsa in the Pakshagata, and also he has given a talk on Vamana Chikitsa in the radio talks in the Harvard. Okay, and also he has given many of TV programs on the coronary artery disease through Ayurveda, and also the management of heart diseases through the Ayurveda, and management of hypertension through the Ayurveda. And sir has also awarded as a best consultant award in the year of 2020 and 21. And sir now presently working as a associate professor in the department of Panchakarma. And sir also has an in charge of Hridya in, that is Ayu Cardiac Unit in the Delhi Ayurvedic Hospital, who is the initiation behind this Hridya OPD. With this brief introduction of sir, so I welcome you, sir, for today's guest lecture. So now the sir will be speaking on the topic approach of ischemic heart diseases from Ayurvedic perspective. So may I request sir to take over the sessions. So over to you, sir.
Thank you, Dr. Manjula. So we'll start topic related to ischemic heart disease.
Yes.
I think the slides are visible.
Yes, sir. Slides are visible, sir.
I think it is full screen, right?
No, sir.
Now?
Yes.
Yes.
Sir, if any mobiles are there in and around, sir, please need to off them.
What?
If anyone has connected the phone, sir, nearby you, sir, so it is echoing. So.
Echoing? Nothing. There is nothing over here.
Okay, fine.
So good morning all. So let us start the topic related with ischemic heart disease. So as you all people know that the current situation related to the ischemia or myocardial infarction is considered to be one among the most commonest form of cardiovascular disease. So you might have heard that many young people, youngsters, either may be a common man or he may be a rich man or maybe any celebrity. Nowadays, people starting suffering with this ischemic heart disease at a very younger age. It's very unusual presentation when you look into from the perspective of textbook of cardiology. It usually occurs beyond the age of 45 or 55 years of age. But nowadays, hardly 20-year-old young man or 25, 30-year group people suffering with this ischemic heart disease. The reasons may be many, which we will discuss later in the coming slides. And this ischemia is also considered to be one of the most leading cause of death. When we compare with other forms of diseases, this ischemic heart disease considered to be the leading cause of death among all types of diseases. So, what ischemia means? So, ischemia refers lack of oxygen because there is inadequate perfusion. So why there is inadequate perfusion? Probably there may be underlying stenosis or obstruction may be the cause, which results into the imbalance in oxygen supply and the demand. So because of this imbalance in supply and demand, the ischemia occurs, which is called as ischemic heart disease. So this ischemic heart disease is considered to be the most common cause is obstructive atherosclerotic disease of coronary arteries. Okay. So another clinical condition is we call it as acute coronary syndrome, which occurs due to an abrupt development of rupture causing a thrombus formation may be a reason for the establishment or the genesis of either unstable angina or sudden myocardial infarction, which occurs instantaneously. So, looking into the risk factors for this ischemia, so we categorize these risk factors, or you can consider it as an etiological factors also, into two categories. One is modifiable risk factors, another one is non-modifiable. Modifiable means there is a scope to modify and the chances of getting into ischemic heart disease may be prevented, but there are few categories which are called as non-modifiable, which cannot be made any changes and one are more prone to suffer. So among modifiable causes or risk factors, so the first one is hypertension, diabetes, hyperlipidemia, obesity, fat-rich diet, tobacco or smoking, and physical inactivity. So if you modify these risk factors, probably the chance of landing into ischemic heart disease may be less. But the things like age of male beyond 45 years and females beyond 55 years, where persons are more prone to suffer. So this cannot be modified. And male gender are considered to be more prone for getting for ischemic heart disease. And if there is any family history of premature coronary artery disease or myocardial infarction, they are also more prone for suffering this ischemic heart disease in their future life. So now let us see one by one of all these risk factors. So among the risk factor, smoking is considered to be most prominent risk factor and very important also. So, this cigarette smoking has several effects on cardiovascular system, like it increases the heart rate and blood pressure, and it causes underlying systemic inflammation in the coronary vessels. So this becomes a primary pathological factor resulting for dysfunction of the endothelium of coronary vessels. So this is the reason why the people who are smokers for a long time are more prone to suffer with ischemic heart disease, and who quit or who decreases cigarette smoking will prevent myocardial infarction by 50% in their future life. So that is the reason why smoking is considered to be the most prominent risk factor. Second one is the diet. So usually fat-rich diet, especially saturated fatty acids and trans fatty acids, are considered to be linked with the incidence of ischemic heart disease. Okay, so these saturated fatty acids will increase bad cholesterol, that is low density lipoprotein cholesterol concentrations. Okay, and the principal source of these saturated fatty acids are animal products. Usually non-veg rich diet will consider to be most prominent of saturated fatty acids, which will increase this low density lipoprotein cholesterol, so which is considered to be the major contributing risk factor for the development of ischemic heart disease. So this is from the list, especially dairy products like butterfat, cheese, ice cream, cream milk, which is having higher rates of saturated fatty acids. I think you know this is saturated fatty acids. So it is rich in saturated fatty acids. So these uh, group of dairy products will have effect on the development of ischemic heart disease. Then physical inactivity. So physical inactivity or a kind of sedentary lifestyle without any kind of exercises is considered to be another contributing factor for the genesis of ischemic heart disease, because this physical inactivity is considered to be a major factor for lipid improper metabolism. So this improper metabolism of lipids will result into either hyperlipidemia or dyslipidemia. So this factor will be contributing for the establishment of coronary heart disease. Then obesity. So obesity is an independent risk factor, because in obesity dyslipidemia will be present as the basic pathophysiological factor, and this uh, dyslipidemia will cause atherosclerosis, that is fatty deposition in the heart vessels. So this will become the primary source for the genesis of ischemic heart disease. Okay, so it is considered obesity where the BMI is greater or equal to 30 are more prone to suffer with the ischemic heart disease. Then hyperlipidemia. So there is a strong positive correlation between total cholesterol and LDL, that is low density lipoprotein cholesterol, linked with the ischemic heart disease risk. Okay, and second is only elevated triglycerides are also independent risk factor for the development of cardiovascular diseases. Okay, so you can see here, this is normal blood cells. So without hyperlipidemia. So once the hyperlipidemia starts, when there is increase in the total cholesterol or LDL or triglycerides, see the cholesterol particles starts flowing in the blood, and gradually they starts adhering or depositing in the blood vessels. See here the proportion of this deposition of fat is more, and now here fatty plaque is building up. Almost it is 20 to 30% in a vessel. See almost this plaque more than 50%. So what happens? So this is normal blood vessels. So here the blood flow is normal. So there is no resistance by a vessel. Hence there is no symptoms and no disease. So when the fat develops in the artery or in the endothelium, it causes an obstruction to the blood flow. So where the blood flow will be limited. So once this is ruptured, so there is thrombus formation will occur. So almost the blood flow to the myocardium is completely stopped. Hence the patient will experience sudden myocardial death. So certain psychosocial factors like depression, stress, anxiety, social isolation and lack of social support and stress at work, all they are contributing for the genesis of ischemic heart disease. It is said by a research that depression after a coronary event, one event of coronary event has already taken place, but if patient continued to be either depressed or stressed or anxiety, it increases recurrent second coronary event. So the chances is threefold. So this is the scientific evidence so that the person who are either anxious or stressed or depressed are having more prone for the development of ischemic heart disease because the inflammation in the coronary vessels will increase and the risk increases by 64%. Another research says that social isolation and a lack of social support may increase the risk of coronary heart disease by 2 to 3 fold in men and 3 to 5 fold in women. So that's what one should always be a social person or who should be in group where his heart would be in good condition. Otherwise, this poor socio-economic status and social isolation will increase the coronary heart disease because of unhealthy dietary habits. Then other clinical conditions like hypertension, diabetes, hyperlipidemia will also induce for the genesis. So hypertension, if there is increase 20 mm of Hg in the systolic pressure and 10 mm Hg of diastolic pressure, so there is more prone of developing cardiovascular disease. And diabetes, so diabetes is a strong independent risk factor because this diabetes will cause impaired metabolism or the transport of low density lipoprotein to the coronary vessels, which will result into the atherosclerotic changes in a coronary vessels that causes the risk of developing ischemic heart disease. Then some of the biochemical parameters will also contribute in the genesis of ischemic heart disease. Those are high sensitivity CRP, C-reactive protein. So this high sensitivity CRP will be the contributing factor because of underlying inflammation. So if there is inflammation in a coronary vessel, so that will induce the chance of getting coronary heart disease because of endothelial dysfunction. Okay. Then hyper homocystinemia. So homocysteine can cause an endothelial function and result in a precoagulant state. So there is coagulation is a possibility when the homocysteine will be elevated in the blood. So that's what this homocysteine increase is also one of the contributing factor for the genesis of ischemic heart disease. Next one is apolipoprotein B. So this apolipoprotein is associated again coronary heart disease because of atherogenetic in condition, means it induces atheroma, that is a blood clot, which is the responsible factor for the genesis of ischemic heart disease. So other fibrinogen and hemostatic factors. So these hemostatic factors and fibrinogen are considered to be atherogenic in nature. So that will be predicted. So if there is increase in the fibrinogen and hemostatic factors, so there is more risk of getting blood clot in the vessels, so which is contributing factor for the genesis of ischemic heart disease. Okay. So this is the pathophysiology. So either smoking or obesity or any mechanical stress, inflammation, hypertension, hyperglycemia will act on endothelium, so causing endothelial dysfunction. So when there is endothelial dysfunction, the nitric oxide is less produced. So once the nitrous oxide is less produced, so it increases thrombosis formation, leukocyte adhesion, impair vascular relaxation, that is vasodilatation is reduced, inflammation will increase, and increase in the oxidative stress. So because of all these factors, what will happen? Either there is atheroma will occur, so which is the contributing factor for the genesis of ischemia. So this will cause loss of, they disturb the normal function of vascular endothelium, like maintaining vascular tone, maintaining anticoagulant surface, and defense against inflammation if endothelium is healthy. But if endothelium dysfunction occurs, so what will happen? Is vasoconstriction will occur, clot formation will occur, and blood monocytes and platelets aggregation start occurs. And hence there is fatty plaque will appear, which consists of fat, smooth muscle cells, fibroblast, and atherosclerotic plaque. Okay, so they develop at regular intervals in different segments of coronary arteries. So when the obstruction is more than 75%, then it starts reducing blood flow significantly. And when it crosses more than 80%, which will cause myocardial ischemia. So the clinical features include the chest pain, okay, ischemic heart disease, okay. So this chest pain is because of poor or inadequate blood supply and oxygen supply to the myocardium, because of which lack of nourishment will occur. This poor nourishment will cause gradual ischemia or necrosis of myocardium, because of which patient starts experiencing chest pain, which is called as anginal chest pain. So this pain is described either deep or poorly localized. Okay, this is associated with exertional dyspnea sometimes, and pain will be relieved after taking either rest or medicine like nitroglycerin. Okay, then the pain may radiate to either jaw, back, or arms. Okay, then it may be associated with either nausea or sweating. So how to diagnose this ischemic heart disease? So this is diagnosed on electrocardiogram. So this is the primary investigation where the disease is diagnosed at an early stages. So based on ST segment and T wave. So you have to watch these two parameters on ECG. So if ST segment depression occurs beyond 0.5 mm, at least in 2 leads, is considered to be ischemic heart disease. And if the T inversion, that is symmetric deep T wave beyond 2 mm, in multiple precordial leads is considered to be critical stenosis. Normal ECG where positive P wave and QRS complex, normal ST segment and T wave. So you look this ECG where ST segment is depressed. So this is the baseline and here is the ST segment depression is present. So this is the few examples related with ST segment depression. Okay, so in case of V1 ST depression, V2 ST depression, V3 ST depression, V4, V5 and so this is V1 to V5 ST segment depression is present. In a similar way, another example where in lead 2, lead 3, okay, lead V3, V4, V5 and V6. Here ST segment depression is present. So T inversion, example of T inversion. So you can see here in V1 T is inverted, V2 T is inverted, V3 T is inverted, and see this is the T inversion which is present over in the lateral leads. So see the examples of T inversion. So this is suggestive of ischemic heart disease. So once there is changes in the ECG, so you have to confirm it by doing stress test. So this stress test is which is inducing exercise. Okay. So the ECG is 12 lead ECG is recorded during and after exercise, usually on treadmill. So here the diagnosis of inducible ischemia will be confirmed. And further investigations like coronary angiography may be done to evaluate how many stenosis or blocks are present. So based on that, it is categorized as either single, double or triple vessel ischemic heart disease or coronary artery disease. Okay. There are other biochemical markers which are indicative of myocardial necrosis or death, like creatinine kinase. Okay, so this is most commonly used biomarker. Usually, MB enzyme has greater specificity for myocardial tissue. So CK-MB levels usually they will increase after myocardial injury for 10 to 18 hours till 72 hours. Okay. So if CK-MB levels are elevated, so you have to think that the myocardial injury has taken place. So immediately patient should be shifted to ICU. Another biomarker which is also considered to be important is troponin, cardiac troponins. Okay, so they are also having high sensitivity and specificity. Okay, so there are three troponins: troponin T, troponin I, and troponin C. Okay, so these troponins will increase only after 6 hours of injury and will be elevated for 5 to 14 days. So this is the way that ischemic heart disease presents, and it should be diagnosed based on these investigations. Now, how to understand this ischemic heart disease from Ayurvedic perspectives? Okay, so in Ayurveda also this this coronary heart disease may be considered under the heading of Hridroga Prakarana. So in Hridroga, our acharyas have explained in detail by making different classification of Hridroga, and even the management is also elaborately explained. So that we will discuss. So the Nidana for Hridroga is explained as per Ayurvedic perspectives like Vyayama, Tikshna, अति विरेक बस्ति चिंता भय त्रास गदातिचाराः ಛರ್ದಿ ಆಮಸಂಧಾರಣ ಕರ್ಷಣಾನಿ ಹೃದ್ರೋಗಕರ್ತॄಣಿ ತಥಾಭಿಘಾತಾಃ. So here Vyayama is considered to be one of the risk factor for hridroga. So here Vyayama means it is ati. Here the word is used ati. So Vyayamam ati. Okay. So here excessive physical exercises like lifting heavy weights or doing exercise for long duration without any rest in between definitely will cause strain in the myocardium, and that results in the sudden myocardial death or cardiac arrest. I think most of the celebrities or the gym persons who are doing very vigorous activities will die instantaneously at the place of exercise only because of this. Ati vyayama will cause excessive workload on the heart, which will cause sudden rupture and myocardial death will occur. So like psychological factor like chinta, bhaya, etc. also are the contributing factors for the genesis. The same are reflected even in ischemic heart disease like psychosocial factors, stress, anxiety are also the contributing factors. The same is explained even in Ayurvedic parlance also. So another explanation by Acharya Shruta. So they said that viruddha adhyashana ajirnaihi asatmescha ati bhojanaihi. So I think most of the people now we are talking about asatmya bhojana or viruddha bhojana. Packed foods or whatever we eat outside are come under the category of viruddha and asatmya bhojana. Like many Western style of food, now it became a tradition to eat Western diet, which is not satmya for our Indian people. So that is also one of the contributing factors that developing ischemic heart disease. Okay. So what will happen because of all these things? Dushayitva rasam dosha. So the rasadhatu, which is considered to be the prime culprit, will get vitiated. Vigunam hridayam gataha. So this vitiated rasadhatu will enter into the hridaya because the mool of rasa is hridaya. So which causes hridrogam prachakshate. That causes hridroga kind of manifestation. Okay, the same kind is reflected in the formation of deposition of fatty plaques in the coronary vessel. Another explanation by Acharya Shruta, they said, Kapha pittavaruddhastu marute rasamurchitaha hridista kurute shula murcha avarodakam param sa hridi shula iti rasanasya sambhavaha. So there is obstruction by dushta kapha, dushta pitta and dushta rasa. Okay, so what it will cause? Avarodakam param. Where it will do the avarodha? Resista kurute. The vessels which are located in the heart, it obstructs the channels of hridaya, that is rasavasrotas and raktavasrotas by dushtarasa, dushtakapha, dushtapitta. What is obstructed? Vata is obstructed. So what is vata? It is the myocardial oxygen which is getting obstructed by this rasa, kapha, pitta, etc., which is considered as rich lipid laden core. Okay, then some of the fibroblast, leukocytes, etc. So all these will cause obstruction for myocardial oxygen, so which is causing krute shulam, chest pain, anginal chest pain, and causes hritshula or hridroga. So this is the beautiful explanation which is explained in the modern contemporary sciences, is also explained by Ayurveda people. So Vataja Hridroga. So Vataja Hridroga, you can see the clinical symptoms explained like Ayamyate marutaje hridayam sudyate nirmatyate dhiryate spotyate patyate cha. So there are different kinds of pain presentations, like a kind of sharp shooting or cutting type of pain is experienced. In Pittaja, Sweda, that's perspiration or sweating, which is the cardinal feature of either ischemia or myocardial infarction, is seen best in Pittaja kind of Hridroga. And Kafaja Hridroga. So Kafaja Hridroga, it is said that Stimita Bharikam. Stimita Bharikam means as if a chest is very heavy, and Supta means just discomfort, like bhavati ashmavratam tata, like a heavy stone is kept on the heart. So such kind of presentation is present in the context of Kafaja Hridroga. So this is the way that how we can understand this ischemia from the Ayurvedic perspective. So what we can consider, so ischemic heart disease doesn't necessarily produce all kinds sets of symptoms at once. So in some patients only chest pain may be present, in some patients only exertional dyspnea may be present, in some patients sweating will appear first. So based on the symptoms that are explained in Ayurveda, one can diagnose either the ischemic heart disease is either Vata dominant or Pitta dominant or Kapha dominant. So based on this specific dominant type of Hridroga, one can treat it more effectively for the better clinical outcomes. So in a summary, so this ischemia may cause either because of fat-rich diet or smoking or physical inactivity or psychosocial factors, and some clinical conditions like hypertension, hyperlipidemia, diabetes mellitus, obesity. Okay, and it is diagnosed based on the clinical history, ECG, cardiac biomarkers, and stress test. Okay, so thank you, and I thank the Dr. Manjula, who has given me an opportunity to talk on this ischemic heart disease and about the Ayurvedic understanding, method of diagnosis. And I thank the management of SBG Ayurveda Medical College for considering me on this event of World Heart Day. So a message I want to give with this guest lecture to all youngsters, that this ischemic heart disease or coronary heart disease sometimes doesn't develop abruptly or simultaneously. There are only very few incidences where it occurs at an early age, means abruptly, but in most of the circumstances, this ischemic heart disease develop in due course of time. It may take either 5 years or 10 years or 20 years. So it is a gradual, slow progress of atherosclerosis. And why atherosclerosis occur? Because there is improper, unhealthy dietary habits and unhealthy lifestyle, which is adopted by the younger generations. So if you could correct this lifestyle and diet patterns in young age, probably you can prevent in your future related with this ischemic heart disease. Otherwise, age of 30 years, probably most of you might have landed this ischemic heart disease, because the current lifestyle and the diet pattern, if we look into it, definitely the rate of prevalence will definitely multiply after 10 years of age, because in last 10 years we could able to see there is a rapid raise in the development of this ischemia and myocardial infarction. Very rapidly it has increased. And if it is not addressed at this point, probably the chances of landing into this ischemia would be doubled by next 10 years. So it is in the hand of younger generations. Kindly adopt healthy lifestyles. Healthy lifestyles means where you have abundant or good quantum of physical activity. Good activity, physical activity is one of the most beautiful exercise for optimum. It is stated that 20 to 30 minutes of physical activity, either it may be a walking or mild jogging or any kind of even yogasana, may be helpful for a kind of physical activity. So this will increase high density lipoprotein, which is also considered as a good cholesterol. So this, the benefits of good cholesterol means it always keeps the heart vessel very clean. It doesn't allow bad cholesterol to get deposited, and it keeps the endothelium in a very good condition. So that is the reason why one should adopt physical activity regularly in their life. Second thing is healthy diet. Healthy diet means saturated fatty acid diet should be avoided. That's all. Means rich of fiber diet. That is either raw vegetables or boiled vegetables or fruits are considered to be fiber diet, which will increase the quality of health and endothelium. So I hope the younger generation will follow these guidelines to prevent from these dreadful diseases. So I thank all of you for your kind patient hearing. Thank you very much.
Thank you, sir. Thank you, sir, for sharing your knowledge with us. And, dealing regarding the what are the causes of ischemic heart diseases and its pathophysiology, and also the Ayurvedic perspective of ischemic heart diseases, and also the sharing how we are going to prevent IHD in the younger generation. Now, any queries, students? If you have any queries, you can unmute your this thing and you can ask the questions.
Sir, good morning, sir. Myself, Dr. Raghavendra Vai. How triglycerides impacts on cardiac diseases, sir? What is the triglycerides importance?
Hello, Raghavendra.
Yes, sir.
What is your question?
How triglycerides
Huh.
impact on this ischemic heart diseases, sir?
Triglyceride is considered to be strongest risk factor in the genesis of ischemic heart disease because it is the most contributing factor for the genesis of atherosclerosis, okay, which will cause endothelial dysfunction and atherogenic in nature. So that is the reason, because there is formation of atheroma, chances is more high in elevated triglycerides level. So that is the reason it is considered to be the most contributing factor for ischemic heart disease.
Sir, for day-to-day life, nowadays, much more talk about the oils. Which oils to be used in daily
What?
healthy regimes? Oils, sir, oil. Oils, cooking oils.
Looking?
Cooking oils, sir, which to be used for a healthy lifestyles.
Healthy lifestyle.
Yeah, for that cooking oil, sir. Nowadays, it is a thought of much more discussed thing.
Okay. You asked about the oil, right?
Yes, yes, sir.
So, now market available oils, which are you now whatever is getting, right? So
Yes, yes,
we
sir.
are not sure what the way it is being prepared. Okay. Most of the times, oil itself may be a responsible factor if it is not prepared genuinely. Okay. So probably that may be the reason, one thing. So otherwise, this cold compressed oils, like in olden days, they used to prepare like ganadenne, okay, which is now termed as cold pressed oil. So that is beneficial. So you can use like soya bean oil, which is considered to be beneficial. Even sunflower oil can also be used. Okay, so they contains polyunsaturated fatty acids that can be used, not an issue. Okay, so these refined oils which are nowadays in market, okay, double refined oil, whatever, which is available with very cheaper rates than cold compressed oils, like, so here we are not sure the method of preparation what they are using, why the cost of the oil is so cheap than what is the actual rate of the raw material. So better to avoid which is chemically processed oils. Okay, better to use which is cold pressed oils like Ghana Denne, what is called now. So if you use it, probably the chances of landing into this uh, ischemic heart disease may be less. Okay,
Thank you, sir. It's a very informative session. Thank you very much, sir.
thank you.
Hello, sir. There are some questions in the chat box, sir.
Okay,
Ischemic heart disease affects more in men rather than women. Can I know the reason?
can you please repeat the question? It is not clearly audible.
Ischemic heart disease affects more in men rather than women.
Yes,
What is
yes.
the
It is not always like it is affects more in men and less in women. Till the age of 55 years in women, it is less. Like in pre-menopausal women, it is less. But in after menopause, that is post-menopausal state, the ratio of getting ischemic heart disease is equal both in men and women. Okay, it is because of the this hormonal effect. Okay, the ladies are having more of high density lipoprotein in them, so it is god gift to all ladies. In premenopausal women, this high density lipoprotein is always on the higher side. So when you look into the report, this HDL should always be more in women and less in men. So this is protecting all females for getting into ischemic heart disease. What this HDL will do? This HDL will prevent this atherosclerosis. It will transport the bad cholesterol from coronary vessels. So this is function being done by HDL, which is present in premenopausal women. So that is the reason why the in premenopausal women the chances of getting IHD is lesser compared to men. Okay, but if the etiological factors are very strong, and if a lady is very strongly exposed to unhealthy diet and lifestyle, she will also prone to suffer ischemic heart disease.
Sir, one more question is, how should we treat IHD patient according to Ayurveda?
Yeah, definitely we can treat. Okay, there we are having our own cardiac OPD since 8 years, and we are treating all kinds of ischemic heart disease, either it is stable angina, unstable angina, okay, or post myocardial ischemia. Okay, we are treating with Ayurveda medicines only, which will include Panchakarma treatment, like a Shodhana kind of treatment first, followed by Shamana line of management. So definitely it is safe to practice clinically in treating ischemic heart disease. So about the continuation of modern medications, you can continue modern medicines, or you can withdraw modern and keep only Ayurveda medicines. Both can be done, not an issue.
So any questions? So I think all queries are cleared now. So thank you, sir, once again for enlightening us with your knowledge. So now I request Dr. Anita, Assistant Professor in the Department of Chikitsa, for vote of thanks.
Good morning, sir.
Good morning, ma.
I wish to express gratitude to our guest lecturer, Ayurvedic physician, my teacher, Dr. Rajashekhar, yes, sir, for enhancing our knowledge. Special thanks to enthusiastic delegates for the active participation, all Ayurveda colleges across Karnataka and India for motivating their staff, students to join this event without whom the session would not be successful. It feels an immense pleasure to thank the founder member, their Shri S.P. Ghatke sir, and Source of Energy chairman, Mr. Amit Ghatke sir, managing director, Dr. Mansi Ghatke ma'am, for their encouragement, guidance, and support. We also thank our principal, Dr. S.V. Gaddili Shetty sir, organizing secretary and vice principal, Dr. Advesh Arketi sir, event coordinator, and finally, technical team, Dr. Vishal Bhanti sir, Rishi and Sandeep, and other teaching and non-teaching staff at hospital and college. We thank once again all the delegates who have graced the lecture and made it a grand success. To end, less of worries and more of happiness, a what we wish on the occasion of World Heart Day. Stay happy and healthy. Thank you once again. Thank you, sir.
Thank you.
Thank you, sir. We'll end the session, sir. Thank you, sir.